Hi, foot movements. Now, foot movements are various types, but they are occurring at different joints, which we will study in this lecture. Now, we will start with the AP view of the foot, which shows the ankle joint, the chopard joint, the intertarsal joint and tarsal metatarsal joint, the metatarsophalangeal joints, and the interphalangeal joints. On the lateral view, we can appreciate the subtalar joint or the talocalcaneal joint. Now, what are the various movements? Ankle is simple hinge joint movements occur in one plane, which are the dorsiflexion and plantarflexion. Second is the talocalcaneal joint, also known as the subtalar joint. Movements occur in sideways plane. The talus sits on the calcaneum, and the foot. It will lead to the inversion and eversion of the foot. Inversion towards the midline and eversion away from the midline. Next joint is the mid-tarsal joint, or commonly called as TNCC, the talonavicular and calcaneocuboid joint, commonly also called as the chopard joint, due to the eponym of the chopard amputation occurring at this level, or the transverse tarsal joint. Now here the movements occurring here are the adduction and abduction. Next we talk about the intertarsal and the tarsometatarsal joint because they collectively contribute to the pronation and supination of the foot. The distal joints, which are the metatarsophalangeal and the interphalangeal joints, they are simple joints leading to the flexion and extension of the toes. Now an important clinical textbook of Indian surgery is the SDS, which mentions that we already know that the plantar flexion and dorsiflexion is at the ankle joint, adduction and abduction are at the mid-tarsal joint, supination and pronation are at the intertarsal and tarsometatarsal joints. Now SDS mentions that inversion is a collective movement occurring combined, which is a combination of all these movements. The inversion occurring at the subtalar joint is a combination of all these movements. Similarly, eversion is a combination of dorsiflexion, abduction, and pronation. That is all. Thanks.